Hi everybody, welcome to episode 53 of SAMA, a program where we invite experts to talk about the area of expertise. This week we're delighted to have Dr. Robert Rowen as our guest. The topic we'll be discussing is ozone therapy for chronic and systemic health challenges. Robert is a registered medical doctor who graduated Phi Beta Kappa from Johns Hopkins University in 1971 and the medical school at the University of California at San Francisco in 1975. He is board certified by the American Boards of Family Practice and Emergency Medicine. Dr. Rowen is affectionately known as the father of medical freedom for pioneering the nation's first law protecting alternative medicine in 1990 in Alaska. He also served on the Alaska State Medical Board. He has a practice in Santa Rosa, California, with his wife, Terri Su, also a medical doctor. Together they have over 66 years of experience in the field of integrative medicine. They have attended medical meetings and travelled worldwide to share their knowledge and experience, especially in the field of oxidative medicine. So welcome to SAMA, Robert, and it's lovely to have you with us.
Thank you.
Now,
how can I be of service?
Well, we are very interested to learn more about the subject of ozone therapy and how it can be used in day-to-day life to help people and with their medical conditions. So please explain to us, what is ozone?
Ozone is a form of oxygen. It is O3. We're breathing right now in this room O2.
Yes.
And either ultraviolet light or an electrical spark can split the O2, and one of the oxygen goes careening off. It hits another O2 and becomes O3. It's not stable for very long. It's got a half-life of about 30 minutes, so you have to make it fresh. It's extraordinarily active. Oxygen that we breathe is not excited oxygen. And that's important. Most people don't understand that. You can mix gasoline and oxygen and nothing happens. You need a spark. You need a source of ignition. Ozone has the source of ignition. So if you put ozone in with gasoline, boom, it's gone.
Gosh, that sounds dangerous. And we're talking about this in a health video.
Well, I'm trying to explain that ozone is activated oxygen.
Yes.
Now, oxygen comes into the body, you breathe it, and oxygen is the single most important thing for life, health, and healing.
Yes.
You can't live more than a couple minutes without oxygen. And it's a long way from the oxygen out here in front of me to the oxygen somewhere in my hand, to the cell somewhere in my hand. It's got to go a long way. It's got to go through several membranes and be pumped and carried by the blood, pumped by the heart. But oxygen is the driving force of everything. For example, this is a mobile phone. Everyone knows what this is. What makes this mobile phone work? There's a battery inside. That creates the power. Oxygen creates the power necessary to run the cell, which means if it's not running, you can't repair, you can't heal, you can't do anything. Ozone has several key effects, all of which I've been aware of since 1986, and it caused me to go to Sierra Leone 4 years ago to fight Ebola. Wow. Which we were successful at, but the world doesn't know because the world is controlled by pharma. And
You're kidding me. This is incredible. You overcame Ebola using ozone therapy.
5 cases out of 5.
Wow.
You didn't know that?
No. Did not know that.
We published it. It's published.
That's amazing.
You look awestruck. But you know what's interesting is this has been published, but the world doesn't know because it doesn't want to know, because the world and all the media is controlled by the pharmaceuticals. Everything is.
Yes.
And they don't want this. They don't want this out there, because if it was, it would upset the apple cart.
Yes.
So we had 5 cases, all of which promptly responded. No one has a track record like that, not even close. The odds of that happening by chance are far less than 1%.
Wow.
So here's why it works so well. What does ozone do to the body? Number one, it improves the rheologic properties of blood. That means the flow properties. That means a red cell has this diameter, a capillary is this diameter. How do you get it through? Well, the red cell has to compress and bend to get through. Ozone helps it do that.
Really?
Ozone helps the red blood cell release more oxygen into the tissue. So when the bus gets to the stop, more people come out. When the red cell gets to your tissues, more oxygen comes off. Ozone also improves mitochondrial metabolism. Mitochondria are the furnaces that make energy. Ozone modulates the immune system, so that if your immune system is like this, it brings it back. If it's like this, it balances it. And ozone is also directly not well tolerated by microorganisms, including viruses. Wipes them out on contact.
Wow.
So all those 5 things were a perfect fit to treat Ebola. I went over there. We were chased out of the country after we started. Pharma got to the government and had us kicked out.
Wow. Wow. And so there's, please explain to us in detail, because this is extremely interesting. You went there, and on a personal level, you would have seen the people that had the Ebola, and you would have felt, gosh, what can you do to help? I mean,
I knew what we could do to help. Howard Robbins and I paid our own way to Sierra Leone. No one financed us.
Gosh.
We had some donations for equipment, but we paid our own way. We managed to get to some patients. We had help on the ground there with a longstanding Sierra Leone physician. And the government turned a blind eye right in the middle of our training at the Ebola treatment center. And I left, felt like I got kicked in the gonads. And it was very clear that pharma was behind this, because if and when we were successful, pharma would have everything to lose.
Wow. Okay, so let's. How do these people take the ozone? Was it in the liquid form?
Ozone is not a liquid; it's a gas. There's a few ways. There's a few ways to administer ozone. In fact, there's several. The chief way that we do it for most effectiveness is blood treatment. We can take some blood out into a bottle. Let's pretend this is a bottle right here. Blood fills up. We put ozone in, mix it up. Blood goes back into the body. That's called major autohemotherapy. There's variations of it, which I do, which are much better. You can do minor autohemotherapy, where you take some blood out, shake it up with ozone, inject it in the muscle.
Oh, wow.
There is direct intravenous gas, where you can take the gas and slowly administer it into the vein. That's probably the most common way it's used, although ozone societies don't like that method. You can put ozone in the bladder, in the vagina, in the rectum, under the skin. You can make ozone water and drink it. You can put it in the ears. You can do it every way but one. You can't breathe it. Very hard on the lungs.
Yes.
But otherwise, you can give it all those ways. And ozone has more benefit for more conditions in medicine than anything I've ever seen in my career combined.
Wow.
Combined. Excepting proper nutrition, detoxification, and stress. If you remove those, ozone does more for more things than anything I've seen in my entire 42-year career combined.
That's incredible. When you talk about those 3 things to remove, that's everything that's in modern life. You'd be left with nothing. Wow. So this is something which is okay. So people are watching this video, or will be watching this video once you've produced it, and they'll be wondering, "Gosh, this is amazing! It's like the answer. how do I start doing it? Because most of the methods you describe can't be done by the everyday person, and doctors in hospitals aren't going to start administering ozone.
Believe it or not, I think there are some Chinese hospitals that are using it.
Really? Okay.
Yeah,
okay.
I think there's a few hospitals there, but people in everyday life, they need to get a small ozone generator. There's some companies that make it. There's two companies that I like. One is called PromoLife in the United States, and the other is called Longevity Resources in Canada. There are significant price differences. PromoLife is less expensive. They can get a generator, and they can learn how to give it to themselves rectally. Last night, I had dinner with one of my patients who came to me from Africa, from Guinea. He lost a lot of his friends to Ebola. His wife is a nurse. She bought a cheap ozone machine, and she's treating people out in the countryside with ozone, just putting it in their ear and having them drink ozonized water. She's curing malaria, infections, and all kinds of horrible things.
Wow. Well, I didn't hear the word drugs in there anywhere. So they're doing it without drugs, are they? They're just using the ozone.
Without drugs.
Wow. This is going to make a few people unhappy, a lot of people unhappy, and a lot of people happy.
Well, it should make the majority of the world very, very happy. But it makes the rulers of the world, the people who run your life, they're not happy.
It's going to take a mind shift for a change. And it is going to...
There you're dealing with the politics of medicine. And the politics of medicine is summed up in one word. Pharma, P-H-A-R-M-A, farms you, P-H-A-R-M-S. Pharma farms you for profit. You're nothing but chattel. And you're being farmed for profit in power. And until the people wake up and realize this, and throw this yoke off of them, we're going to have more people getting sick with more diseases and staying ill with bodies that cannot heal.
But I do see a shift in people's attitudes. I see more and more people being interested in the work that we're doing. And so that's a positive move. You know, Robert, I bought myself an ozone generator about maybe 4 months ago. It was a very cheap one and it stopped working. Or the level of ozone went down. It's one that uses an aquarium type bubbler for water, and you just put chilled water inside and it does it. But I tell you what I noticed though, at that time I was on a diet. I go on diets every now and then, like I'm on one now, and I found that it increased my metabolism and my weight. It does.
That's one of the things that it does.
And I thought, well, this is my imagination, because I just find it so, you know, my weight, I generally go down about 100 grams a day, but it's going down 200 grams a day, which is, you know, really thumping.
I take ozone. I take high-dose ozone once a month myself, just as part of my general preventive and body maintenance.
Okay, and so you take it as a liquid form, as in, you know, water's had it...
Intravenous.
Oh, wow. Would you do that yourself? Oh, you're a doctor, yeah. So...
Yeah, I do it myself.
But you've done I mean, for someone like myself, I wouldn't consider that, because I'm not a doctor. I don't stick a needle in myself every day, you see. I didn't do that as a child, so...
I can do it, and if I don't have a needle to stick in myself, I can take it rectally.
Yeah.
Women can take it vaginally. Everyone can take it in their ears. Everyone can make ozone water and drink it.
Now,
it's extraordinarily healthy.
So is it just a tube straight into the body orifice, or is there at the end, does there need to be some sort of a dispersing shape?
Well, you get a catheter. You just get a plastic catheter to put in your rectum or a vagina.
Yes.
You can bubble ozone through a hose. The companies have the apparatus to make ozone water, and they have a stethoscope that's made so that you can pass ozone into your ears.
Oh, wow.
It's not that difficult to do.
Oh, okay, so someone that gets earache, would it be quite
absolutely good? This woman in Guinea is getting rid of ear infections like in a day.
That's amazing. So even just a hose, you can hold a hose up to your ear, and then you can...
You just got to be sure you don't breathe it.
Okay. That's absolutely amazing. So you're describing something which is safe unless you breathe. And in making it, if you have an ozone generator, that's all you need, isn't it? Just an ozone generator with a hose.
You need an ozone generator and the equipment for delivery.
Delivery equipment. You say you're talking just roughly on costs. Are these the one I bought was a cheapie, so we'll disregard that completely. The better ones, how expensive are they?
Well, the longevity makes a fine machine. They're in Canada, and their machine, the one that I like, is about $2,500 US. Promo Life makes theirs pretty equivalent for about $1,000 less.
Okay.
And one company is going to tell you, I'm friends with both companies, and I want to be friends with both companies. Because I deal with both, and I have patients. Yeah. Some want to go there, some want to go the other way. But if you contact either one of those companies and you mention my name, they will automatically know what you want.
But they'll add another few dollars on.
They don't. It makes it easier for you. It does make it easier for you if you mention me, because they know that you've heard about this from me, and they will know what you're looking for because it's what I recommend.
Okay.
Good try. You lost.
I did try, and I did lose. Well, this is remarkable. Now, do ozone generators have a life?
Yeah, they might. That's one of the things that one company will say, ours is going to last this long, theirs is not going to last this long. I've heard that back and forth for a long time. One might guarantee their machine for 2 or 3 years. One of those companies guarantees their machine for life.
But it's the life of their machine. That's a long time, so therefore it must be just the way it's constructed, I suppose. I guess there'd be more than one way of generating the ozone within the machines.
Not within the machine.
Okay.
There's more than one way of generating ozone, but this machine is only doing it through what's called a corona arc discharge.
Okay, so it's a spark, if you like, and then air passing over that spark. Yeah, but maybe I'll pull my one apart because I am an engineer, and I'll see why it's. I'll probably find I can't put it back together again because it's so flimsy, because it was so cheap. But I knew it was cheap. But it introduced me to something which is quite remarkable, which is why when we saw you and your work that you do, we were so interested and wanted you on the show. So thanks again for coming on. Now, the chemistry behind ozone. You've explained how one of the molecules splits away and then joins another. But then the one that gets left behind, isn't that like less one? How does it work? Because you've got the molecules, one flies off and it's energized, goes off, and then joins another one. What happens to the one that's left behind?
That's going to be picked up by another O2 molecule, so you'll get 2 O3s.
Oh, okay. That's how it works. I was never too great in chemistry. So therefore you don't get any residual bad, oxygen, a type of oxygen, and a form of oxygen which isn't so reactive and negates O3.
O1 is not going to exist.
Okay. It actively seeks.
If it exists, it's microseconds. In what you're doing, it's just not going to exist. Now, when you put ozone into blood, you might get an O1 reaction.
Yes.
O1 is extraordinarily oxidizing. So ozone is the strongest naturally occurring oxidant.
Okay.
There's no other oxidant naturally occurring that is as strong as ozone. Only fluorine gas is stronger, and fluorine is man-made.
Yes. Oh.
Now, I don't know if you did this, but I may have a criticism for you. Did you look at my YouTube videos before you interviewed me?
Yes, I did. There was 2 of them there.
All right. Well, then you did the right thing, because my YouTube My YouTube channel tells you just about everything you need to know. It gives you a whole variety of cases that we have seen, hundreds of patients with knee problems, hip problems, back problems, dental problems, Lyme disease, tick bite, cellulitis, infections, flu, you name it, almost everything is there. Last night, yesterday, a woman came to me with a disc compressing her nerve roots. She was in horrific pain. She had 3 failed back surgeries. She had been given intravenous narcotics, oral narcotics. She had been to scores of doctors. No one was able to help her. She was at her wit's end. She wanted to work. She's not a drug seeker. She wants to work. But she's dealing with horrible 10+ pain. Plus, pretend this is her foot. She didn't have feeling on her foot, and her leg had paresthesias. And she had a drop foot, so she couldn't get her foot up like this. That's crippling. 1 treatment. She's normal. She's on my YouTube channel right now. She was my last post last night. 1 treatment. Imagine the hundreds of thousands of dollars that was spent on this woman for her surgeries, her hospitalizations, amongst other things. Hundreds of thousands, if not over $1 million. 1 treatment. And you should look at that. It's mind-blowing.
I will after this one. When I looked at your videos,
is wool how the British say will? WOOL?
Wool. Wool, as in woolen clothing.
Yeah, I'm just getting on your case. I will.
Oh, I see. Well, I do both. I always wool. I've got wool everywhere.
Okay.
Now that's I have a New Zealand accent for some reason, and it sounds Australian to most people. But I don't mind. Australia's a great place too. But this is just the way it is. We can't help where we're brought up. But this is remarkable what you're saying, because like a nerve compression, that's a physical.
It's a physical. She had a physical event that was compromising her nerves, causing weakness, causing horrible pain, and causing sensory deprivation.
Yes.
And I treated her with ozone and a particular type of injection, and she's now normal.
How would that have worked? What are the mechanics behind that, Robert?
Ozone modulates inflammation.
Oh, of course. Great.
It just took out the inflammation. The nerves woke up.
I just had a mental picture of someone walks into your practice, out comes the ozone even before they start talking.
Hey, listen, sometimes they're wheeled in a wheelchair and they walk out.
Really? Wow. So really, ozone should be a first to. Every practice should have ozone bottles there.
That's how I think.
Now, do you have bottles of ozone, or do you have a generator that generated on the spot? Because you did say it had a short...
I told you that ozone has a very short half-life.
I was just going to say, but you beat me to it again. There's two blows I've had now. I shorts late in the evening because you're pretty sharp. It's like you've just had your breakfast and you're ready to go. Now, I want to focus a little bit on your life, because your other videos didn't do that. And it's something which I think you're very... I admire what you've done terrifically, because you're behind the passing of a law in Alaska for alternative medicine. In 1990, you pioneered the first law, actually, and this was part of your introduction. But I want to focus on that a bit because it really is amazing. In 1990, it was a totally different landscape to now. So let's start. This is what I want to know. I want to know how you became so interested in alternative medicine. And I want to know how you became so passionate. 2 things.
Well, I've always been an environmentalist. I want to protect the planet.
Yes.
The earth is our mother, and you don't want to pour chemicals and acids and solvents into your mother. You want to protect your mother.
Yes.
Because your mother comes back to nourish you. And I came to see in medical school in my third year that we were treating our patients the same way we're treating the planet. We were dumping all kinds of poisons and chemicals into them and getting nowhere.
Yes.
And I got very depressed and I almost quit medical school because I said, what am I here for? Am I here to be a pimp for the pharmaceutical whores, just to push drugs into people and keep them maintained on drugs for all their life? I almost quit. But I decided I had 3 years in, so I would finish. But I made a commitment to myself to always look for ways not to dump chemicals into people.
Yes.
So I kept an open mind. I have to admit, I was, like other doctors, brainwashed by the medical system, but I kept an open mind. I was willing to look.
Yes.
I got involved in medical hypnosis and acupuncture. And acupuncture led me to nutrition, which then led me to a variety of things. And in 1986, I stumbled across ozone at a meeting. And I said, ozone, that's an oxidant. Aren't we supposed to be scared of oxidants?
Yeah. Yeah.
And the company didn't know what they had. So they gave me some written material that they had from Germany, and I took it up to my room. I stayed up all night reading it, actually till 2 a.m. I couldn't put it down. And I'm not a morning person. I got up a half an hour early to get to that exhibit hall the next day to be first so I could get that machine.
Really? Wow.
I got that machine, and as soon as we started using it, it changed my entire life and my professional career. You know, if you're a physician, if you're an honorable physician, your patient comes first.
Yes.
Above everything else, above the medical society, above pharma, above politics. That patient in front of you is the entire universe.
Yes.
And that's my duty to that patient. And that's how I proceeded with this. It was not a harmful treatment. I took the Hippocratic Oath, above all, do no harm. It's basically 100% safe if it's done right. And it can be done wrong. And I ran with it because it just did so much good for so many things.
That's an amazing story. That's absolutely amazing. That's part one. What about part two? This you're behind this this law protecting natural medicine. So you didn't.
By 1988, after I was well involved with this type of medicine, I saw many of my colleagues in other states losing their licenses and not hurting people. They were losing their licenses simply because of their philosophy of medicine, natural medicine.
Terrible. Yes.
A lot of them. So I thought if anybody could do it in the United States, it would be us in Alaska, because I was a big fish in a small pond, small population, and I had access to a lot of people, and I even saw politicians. So I decided to make a stab at getting a law passed that protected a medical license, and I figured if Alaska got it passed, then other states would pick it up, which happened. Now, the response of the medical mob was to try to take my license. They brought up a quackbuster, and they did everything they could to discredit me, defame me, question my ethics, called me a fraud, but it didn't stick. The public was solidly behind me. So the law got passed with overwhelming public support over the brutal opposition of the medical mob. And then 2 years later, Governor Hickel appointed me to the medical board, again over the brutal opposition of the medical mob. But I was confirmed by the legislature because of widespread public support.
It was interesting to note that you didn't group politicians with people, but I'm sure some of them are good. But you certainly were working with good ones in Alaska because you got it through. So
they were responsive to their people, and my representative from my district said that the legislature got more messages about this issue in 1990 than any other issue since the Vietnam War.
Gosh.
How about that?
That's just amazing.
Yeah.
Wow. That's quite some story. So it's still, that law still stands in Alaska protecting alternative medicine?
It sure does. And California passed one shortly after I got here.
Wow, really? Actually, I heard that California were comfortable with alternative medicine. I heard that. Most countries and most states, I guess, won't be. But you've started something. You've lit that fire. You've lit a spark. So you must be quite happy with yourself because fires spread. They've got a habit of doing this, you know.
Yeah, about 14 other states have passed similar laws, and medical boards generally are relaxing their their draconian attacks on alternative doctors. It's not a done deal, but it's better than it was.
So you've done a great thing. Even, you know, the word alternative, I always cringe a little bit when I hear that because...
I don't like the word.
No, I don't either because really...
They're the ones who are alternative because they're putting foreign chemicals into the body.
Yes.
That's alternative.
We're not going to argue on that one. That's for sure. Perfectly aligned. Wow. Okay, so... I'm pleased we talked about that because that is really quite some story. So that was in Alaska. Were you living in Alaska at that time? Were you doing your studies there?
No, I moved to Alaska in 1979, and I stayed until I married my wife. Around 2001, I was there for 22 years.
Yes, it's a long time. Wow. And so in your practice at that time, you're doing ozone and you're doing ozone treatment then, or was it
ozone was a very large part of my practice then. I did chelation therapy, ozone pain management, a discipline called neural therapy, nutrition, detoxification. I mean, it's all basic common sense. You want something to work right. If you want your equipment to work right, detoxify it, clean it. Get all the grunge and the carb and the particulates out. We take better care of our engines and our carburetors than we do of our body.
We polish it. Gosh, you're speaking words of wisdom. Each week people polish, they wash and polish their car, and they may be smoking or taking some anti-statin drugs, which are the worst things you could do for lowering cholesterol. I suppose what does ozone do to cholesterol? I suppose it lowers that as well.
It probably does.
Yeah, well, that's something so simple. If someone can have an ozone machine on their bench in the kitchen, and then each morning they have a glass of ozone, then...
It's a good idea.
It will certainly address many, especially early on stage diseases. When I first started taking ozonated water, I found the taste quite unappealing. But after a few days, you don't even notice it. In fact, after a few days, and you drink normal water, you kind of miss it.
Right.
I guess it's your body saying, well, once you pass the taste buds, it's actually doing a lot of good. So, bring it on. Is there a limit to the amount of ozone you take in your body?
It's pretty hard to reach the limit.
Yeah.
You're not going to reach that limit drinking ozonized water. I don't think you're going to reach that limit rectal ozone because you'll poop your entire colon out if you give that much.
Yeah.
I'm taking... once a month, I'm taking 144,000 micrograms of ozone. 144,000 micrograms. And the standard treatment is about a 20th of that.
Okay.
So ozone has a wide margin of safety. It's very well tolerated by the body, but you got to watch how you give it.
Okay. Is there other natural sources of ozone in the earth?
The ozone layer.
Yes. Which everyone associates as being a good thing because it protects us from ultraviolet. So
that's right.
So it gets good publicity from that. Now, there was an ozone hole around Alaska. Did you have anything to do with that? I got you, didn't I? I got you.
No, I treat patients, John. I don't treat the atmosphere.
But it was around the landscape. I know because...
no, it wasn't. It was around the South Pole in Australia.
Oh, yeah, okay. And New Zealand, this is how I knew.
Gotcha.
Oh, okay. But perhaps you could have put some of your equipment to good use at night time when you're not using it and pumped to... Doesn't work that way. But is that the same ozone? The same ozone?
It's the same. It's the same molecule.
Okay. And so it's got a very good, I suppose the Americans would call a good rap, that molecule. Is there any downsides to ozone?
There's some conditions we don't want to treat. I wouldn't treat any woman in the first trimester of pregnancy.
Yes.
Hypothyroidism could be a problem. There's a few other conditions, but it's rare.
Okay. I'm going through the questions that we had pre-prepared, and I think most of them we've actually covered just through the natural flow of the conversation. Now, one thing you mentioned was, at the start of the talk, you're talking about a large red blood cell going through a small capillary. But how does ozone do that? How does the... I mean,
it improves the flexibility of the cell.
Well, that's a good thing.
Yes, it's a very good thing.
So if someone was having a stroke, is it too late to administer ozone?
If it was a thrombotic stroke, I would give them ozone right away.
Gosh. Even faster than drugs. Gosh. Wow. Because I guess if you do it intravenously, it's right at the point of the problem. Just, wow. Isn't that amazing? And you haven't got much time on your side if you've got a blockage in your thrombone. Okay, we've covered the blood cells, mitochondria. Okay, now, why is ozone so lethal to pathogens?
We are oxygen breathers.
Yes.
Our cells are capable of handling oxygen.
Mm.
Viruses don't breathe at all, and they have structures on their membranes that are very susceptible to oxidation.
Yes.
I mean, what do you use Clorox for, or hydrogen peroxide? Don't you do that to sanitize?
Yes.
Did I get you again?
No. I was just smiling because I've had a few anecdotes.
Those are germicides.
Yes.
Hydrogen peroxide kills on contact, so does bleach.
Yes.
Ozone is exactly the same thing, only it's much more effective, much faster. The reason why it doesn't get us is because our cells are made for that kind of challenge.
Okay. No, I was just, when I was a child, I put some peroxide on my...
Hey, I shoot it here. Look. I shoot ozone here.
Why?
So that I keep my hair.
You're kidding me.
No.
You can just put the hose with ozone coming out over
Not a hose. I take a needle like this and I shoot it into my head.
Oh, yeah. Oh, gosh. Okay. Something else. But what if you were, because ozone permeates semi-permeable membranes, so what if you were just to do it the Joe Bloggs way and just put a hose over your head? Oh, that'll be a bad thing, wouldn't it? Because that'll make one's natural grey become more natural grey, I guess, wouldn't it?
Yeah, and then you're going to breathe it, so you don't want to do that.
No. Okay, so it's two very good reasons why you shouldn't do that. Well, I didn't realize that you could actually intervene this into your scalp and stop your follicles from doing what follicles do when you get older. Wow. Okay, so the ozone, because it's so active, it forces oxygen, I guess, onto the pathogens, and they can't handle it, and so they...
Ozone is like taking a shotgun to a bacteria. It just tears it apart. Gosh.
Now, you're talking about putting ozone and introducing it in any orifice in your body apart from your lungs. Now, can we discuss that a little bit, please? What is the major? What are the reasons why it can't be done through your lungs? Why can't
your lungs cannot tolerate that type of oxidative stress? Your other cells can. Your lungs cannot. It's very irritating to the lungs. And if you continue to expose your lungs to it, you can damage your lungs.
Okay. So your sinuses, things that happen there.
You can shoot it into your sinuses. You just can't inhale it into your lung.
By shoot it, you're not talking needles again, are you? Because you've got a habit of talking needles.
Just pretend that this is a needle, this is a syringe.
Yes.
So you put the syringe, not with a needle, in your nose, and you shoot it up your nose while you're holding a full breath, and it treats your nasal cavity.
Oh, wow. Oh, well, that's easy. That's safe.
Mm-hmm. You just don't breathe it in. You have your lungs are already full, so you exhale, and that gets rid of it.
Okay. So again, talking without needles, if you know how often you can feel that you've got a cold coming on, the early stages, can ozone help with that?
I was lecturing in Europe in the fall, and that's when this bad flu was going around.
Yes.
I came back quite ill. When I arrived, I went to the office, took a high-dose ozone treatment. I got better right on the chair, and I was working the next day.
Wow. Now, your high-dose ozone treatment, is that intravenous?
Of course. It's the only way.
Okay. But, of course, I guess you can do sinuses if you feel that you've got a bit of a condition starting there. Would that help with early onset? I mean, not many people have got needles at home. That's really what I'm saying.
Well, that's why I'm telling you, without needles, you can make ozone water.
Yes.
You can give yourself ozone in the ears.
Yes.
You can put a catheter in your rectum. Women can put it in their vagina.
Mm.
You can get an ozone sauna with your head sticking out so you don't breathe it and the rest of your body is bathed in ozone. You can put wounds. If you have a wound here, you can put it in a bag and fill up the bag with ozone so long as you don't breathe it, and it treats the wound. There's many ways that you can do this at home.
Okay. 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 And with the sauna, does the ozone enter your skin?
Yes, it goes through your skin.
Okay, and I guess it's quite a large surface area. So
Yes.
It's a dry sauna, is that correct? No water?
It's actually a steam sauna. You want a steam sauna.
Okay, but hot water has difficulty holding ozone, I believe.
The steam sauna, ozone is soluble in water, and you want steam to condense on your skin because that will attract the ozone and carry it into your skin.
Got it. So the ozone is not in the steam itself, but around the steam.
The ozone is added to the steam.
Okay. That sounds like a fantastic idea. Did you play a part in that invention?
No, not at all.
Did you play a part in any design of any ozone equipment? Or
I am trying to design an ear stethoscope, so that I am doing, and I'm trying to design something to deliver ozone to the mouth. That hasn't been done yet. I have not designed any ozone equipment, but I have participated in treatment programs, and that's what I do to help patients.
Well, you've been working in ozone for a long time, and if you're very, very impressed when you first started, and even now you say that all the other methods combined for treating conditions, ozone still stands head and shoulders above any of those.
Above everything combined.
When you say the word combined, that's not a throwaway comment either. That's quite amazing. When you're using ozone for teeth, for tooth issues.
I'm not a dentist.
No, but perhaps people have like a sore tooth or want to.
You can shoot ozone into the bone. A dentist can shoot ozone into the bone. I will shoot ozone into the cheek here.
Yes.
You can use ozone in the mouth with water. So yes, it's useful dental. Good dentists are using it a lot.
If the ozone water is extremely easy to make, and so I'm thinking perhaps you can make could you gargle in your mouth and swirl it around? Would that have a benefit, or would the ozone keep
Yes.
the water? Okay. So another question I have is this. We've made ozone water and we drink it. You've said it kills microbes, but you've got beneficial microbes in your gut. So
Good question. Excellent question, and I get this all the time. The beneficial microbes repopulate themselves. It's a non-issue.
Okay. Well, that's a quick answer.
Yeah.
How does it repopulate? Are there some residual populations which evade the ozone water?
You're taking microbes into your digestive system all the time with every meal you eat.
Mm.
If bad guys get established, you want to get rid of them.
Mm.
You want to keep a good diet because the good diet is going to bring more of the beneficial germs to repopulate. Lactobacillus, where do you think it comes from?
It comes from lactose milk, which is probably yogurts or any milk.
It comes from the soil.
Really? And it's really? Ah.
The microbiome of your intestine comes from the soil microorganisms. Your microbiome in your gut is a tropical rainforest, which is one with you.
So I guess you'd be a fan of hydroponics then.
Maybe.
Wow.
That's a different topic, and I don't want to go there. There's very interesting things about the gut microbiome, and that'll be a topic for years from now with people who know more about it than I.
Mm.
Our time is closing now because I gave you an hour, and I've been here almost an hour, and I got work to do.
Every moment in this conversation has been solid gold, and I'd like to thank you for your time. You've been very generous and generous with your knowledge as well. I commend you for all you've done. Not many people I've talked to have helped pass a law, and it's a law which I never knew about that. That's really remarkable. So Alaska is a better place thanks to Dr. Robert Rowen. So thank you so much for your time. And thank you, viewers, for watching this video. Have a pleasant evening. Thank you so much for your time. Bye-bye.
Thank you, John. Bye-bye.
Bye-bye.